Hi, I'm Dr. Anusha, consultant at Dr. Vijay's Cosmetology and Hair Transplantation Center. Today we are going to discuss about gynecomastia. What is gynecomastia? Enlargement of the breast tissue in males or man boobs is known as gynecomastia. What are the causes for this gynecomastia? Generally, the breast tissue is present in the females and surprisingly, it is even present in the males also. But in the males, this breast tissue is in a dormant stage, that is, it doesn't grow. When there is a hormonal imbalance between the male hormone, that is the testosterone, and the female hormone, that is the estrogen, or a combination of both, that is, if there is a decrease in the male hormone or if there is an increase in the female hormone, then this will trigger the breast tissue to grow and henceforth this will lead to gynecomastia. So what conditions will lead to this hormonal imbalance? The most common condition is puberty, that is in the teenage, that is the peak where there will be a hormone fluctuation. And certain diseases can also lead to this hormonal imbalance, and even certain medications or drugs, and most commonly steroids, also will lead to this hormonal imbalance. And even at the old age also there will be a hormonal imbalance, which will trigger the growth of this breast tissue. Though this hormonal imbalance can be corrected or itself can get corrected, but the breast tissue which is once grown, it cannot be decreased. It only has to be removed. So what are the types of gynecomastia? Types or the grades of gynecomastia? Grade 1, Grade 2, Grade 3 and Grade 4. Grade 1 is very mild type of gynecomastia where there is only little puffiness around the nipple and the chest is almost flat. So some people may require correction and some people may not complain even about it. Grade 2 and Grade 3 is moderate type. Grade 2 is moderate without any skin excess and Grade 3 is moderate with skin excess. And Grade 4 is severe form of gynecomastia wherein we can find female type of breast. So what is the impact of this gynecomastia or why it should be treated? Because of this breast tissue or else because of this female pattern of breast in a male, generally they will have this, it will affect them psychologically, wherein wherein they will have a social stigma. They are made fun of and they can't go out bare chested. They feel uncomfortable if they wear t-shirts and they will have a social inhibition. So psychologically, and some people may go into depression also, especially the young males where they are made fun of, they will go into depression. So it needs to be treated. So what is the treatment that is available? The only treatment that is available is surgery. It cannot be treated by means of any medications. It can be treated only by means of surgery. So what is the surgery that can be performed? Depending on the grades, this can be done. One is a liposuction. For example, if there is a grade 1 gynecomastia where there is only puffiness around the nipple, only liposuction is enough, where by means of liposuction only the gland also can be removed and it can be performed under local anesthesia. For severe and high grades like Grade 3 and Grade 4, it should be done under general anesthesia, and the procedure that is done is liposuction combined with gland excision. So how is this done? Liposuction, a small incision is given in the axillary region and a cannula is introduced into the chest, wherein the fat that is present around the chest area, it is liquefied and it is sucked out. The liquefied, whatever fat which is liquefied, it is sucked out by means of the cannula. Then a periareolar incision is given, that is the incision is given in the nipple area and the gland is excised. Now post procedure care. Now this procedure is completed within 45 minutes to 1 hour depending upon the degree of gynecomastia or the grade of gynecomastia. Now post operative care, what care should be taken? Generally we advise the patient to wear a compression garment or a vest is given. Why is this vest given? Because a gap is created. We have removed the fat and we have also removed the gland. So a gap or a vacuum is created between the skin and the underlying chest. So in order to obliterate this gap and in order to prevent the sagginess of the skin, we have to keep it attached, or we have to keep it tightly attached to the chest. So this can be achieved by wearing a compression garment or the vest. And this compression garment, it should be worn 24/7 for a period of 1 month. Only at bath, during times of bath, it can be removed. Otherwise 24/7 it should be worn for a period of 1 month, and thereafter for 12 hours it can be worn. And next, the antibiotics, which generally the doctor prescribes, they should use the antibiotics for 10 days. Next commonly asked question is, when should we resume to our work? Generally on the third post, on the day of the surgery itself, you can get discharged, or else on the next day, and you can resume to your work after 3 days. The next commonly asked question is, when can I exercise, or when can I go to gym? It is better to avoid going to gym or performing the chest exercises up till 3 months. You can go for walking or you can go for running after 1 month, but avoid doing chest exercises, push-ups, lifting heavy weights. All these should be avoided till 3 months, and the pressure garment should be worn up till 3 months for the best results. Thank you.